What's up guys, Dr. Adam Hotchkiss here, and today I'm heading to Istanbul, Turkey to get a hair transplant. You might be wondering why I need a hair transplant. Well, looks are deceiving because recently I shaved my head and then I tilted down and I noticed, dang, I've got some significant recession. We're looking at probably like a Norwood 3, maybe even a Norwood 3 with some vertex, because I do feel like I'm thinning right here. Now it looks fine when my hair's grown out a little bit because, it covers it up, but when I buzz it, which I like to do for low maintenance, I get this gnarly recession. So I figured, what the hell, let's go do it. But oh my god, you're going to Turkey. Aren't you nervous you're gonna get maimed? Honestly, not at all. And this is coming from me, a surgeon. You see, I've done my research, and Turkey does thousands of these a year, literally probably hundreds of thousands, if not millions of these a year. Turkey is literally known as the hair transplant place of the world now. Everyone goes there to Turkey to get their hair done. And yeah, I've read Reddit, and I see you trolls on there saying how they're gonna screw up your hair, and your main complaint is usually, well, they have nurses do it. The doctor doesn't even do it. Well, newsflash, the surgeon doesn't always do the procedure here in the US either. Yes, some probably do, but I think it's more common to let the nurse or the technician do it, if I'm being honest. This is something that the popular hair transplant YouTube doctor, Dr. Gary Linkoff, who's a US-based MD, has even said himself that his techs or his nurses do a bulk of the procedure. So this is a super tedious job, but it doesn't take a surgeon to do it. What they're basically doing, they have all of these thousands of little follicles, and they're taking them one by one and inserting them into the hole that the doctor has already cut. And that's how it's going to go down in Turkey too. So in Turkey, the surgeon's going to come in, do the consult, draw out the hairline, do the initial incisions because he is the surgeon, and then the technician or the nurse is going to fill up those holes. Now, honestly, if the nurse did the incision too, I wouldn't even worry whatsoever. We're talking a very small incision, and yes, you always run the risk of surgical complications. That's the fact here in the US as well. But remember that if they're the ones doing it, they do thousands of these a year. That is all they do. Compare that to a doctor here in the US, like a plastic surgeon or a dermatologist who maybe does 1 to 5 hair transplants a week, and then they're also doing breast augmentations and lip filler and Botox and things like that. Now, that's not to say that there isn't some really good hair transplant surgeons here in the US, because I'm sure that there is. But if I had my choice between a surgeon who does 5 hair transplants a week versus one who does 5 a day, I'm going to go with the one who does 5 a day. Now, this is just my opinion on the matter. It's my scalp, it's your scalp. We each can make our own independent decisions based on our own independent opinions. So do whatever you think is best for you. I'll be getting this procedure done by Hair Centers of Turkey. So I went looking around doing my research, and I found them on Instagram where they had millions of followers with a ton of videos of success stories. I personally like to see pictures and like to see people say, hey, I got my procedure done here and this was the outcome. I do get a little weary of that sometimes because there are some clinics who seem to only post the big influencers. So one thing that I definitely do is I click on the person and see, do they have a really big following? Because if they're giving the special treatment to, say the C-bums of the world with millions of followers, and then they're just not doing very well for the little guy and they're just not posting it, that concerns me. But when I looked at these hair centers of Turkey, they had people all around. They had really big influencers, but they also had small people who had zero following whatsoever giving their testimony on there who had really good outcomes. So I decided to go with them. But you guys know me, and I will be brutally honest about the entire procedure. And I think that since I'm a surgeon, I'm going to have a very unique perspective on this. And I'm making this, and I'm going to take you through the entire thing in hopes that there's somebody out there in the shoes that I'm in now wondering what the heck is going to go down. So I'm going to tell you about the entire process, from the flight to the lodging to the actual procedure itself and any bit of recovery that I go through. You guys will see the good, the bad, and the ugly. So you may be wondering, what does this cost? Well, I'm sure you've concluded that Turkey does this a lot cheaper than we do here in the US, and that's why so many people are going there for surgery. See, from my research in the US, hair transplant procedures are going somewhere between $10,000 upwards of $20,000. It seemed like the average was probably somewhere between $10,000 and $15,000 per surgery. Now in Turkey, I got multiple quotes, and the highest that I was quoted was $4,000, and the lowest that I was quoted was $2,000. So you're looking at somewhere between $2,000 and $4,000 for your hair transplant in Turkey. Another thing that they all come with is a package deal where they put you up in a room and they give you the transportation. So they pick you up from the airport, they give you a room, usually a 5 5-star hotel. They're very, very nice. They give you breakfast there. They take care of the procedure. They drive you back. And then they usually do some add-on, like my clinic is going to do a PRP. Some of them do laser. And then they send you home with a goodie kit full of your antibiotics if need be, your pain medication, and special shampoos. This is all for a max of $4,000. That's a pretty damn good deal when you compare it to an average of around $15,000 here in the US. And the procedure that I'll be having done is called a FUE, or a follicular unit extraction. So what they do in this procedure is they go towards the hair on the side of your scalp or here in the back of your scalp, which is known to be DHT resistant, meaning it doesn't fall out due to DHT. And they take that hair in one single follicle and they move it to this part of your hair where you're now bald due to the previous DHT exposure. The cool thing about the FUE versus the old school way, the FUT, is that you don't have to deal with a big scar. You see, in that old procedure, the FUT, they used to take out a big chunk of your scalp and then they would transplant that anteriorly or forward on your scalp, and that would leave you with a really big, hideous scar. But now when they do this small FUE procedure, they're taking such small little plugs that you don't really get much scarring. I've had quite a few friends go over to Turkey, come back, and I've looked at their scalp after they've healed, and even with my surgically trained eye, I can barely see any scarring. That's usually because the adjacent hairs will grow over that area. Now, if you get a skin fade, maybe you might see some small amount of scarring, and of course, you may scar differently than another person, and your scarring may be worse. You may kind of have a polka dotted area. That's definitely a possibility, but from what I've seen, I haven't really seen many people experience that, and I've looked at hundreds of pictures online, and I just really can't tell when it's all said and done, when it's healed, that they had anything done. So that's what I'll be doing, and I gotta catch a plane right now. We're looking at a 14-hour flight from here in the US over to Istanbul, Turkey. I'm taking Turkish Airlines. It's nonstop, which is awesome, but it is 14 hours. That's excessively long in my opinion. Oh yeah, and by the way, the cost of the flight for me was around $2,000. Now that may vary depending on where you are in the US, but I would just average and estimate for around $2,000 on travel. Okay, here we go. All right, what's up guys? Today is the day of the procedure. It's around 6 a.m. today. They're gonna be picking me up at 7 to head over to get the procedure. Now last night they told me to not have anything to eat or drink after midnight. That's what we like to call NPO after midnight. NPO basically just means nothing by mouth, and after midnight just kind of arbitrarily, because by the time that you have surgery, your stomach should be clear. Now I would really like some coffee right now, and honestly, if it was available to me, I would have coffee. I always tell my patients that date of surgery, you can have coffee, just have it black. No sugar, no cream. The cream is the thing that we really care about here because that can kind of congeal and be a solid in your stomach, and what we really don't want here is asphyxiation when you have anesthesia. But this is most concerning is definitely when you're getting general anesthesia, when they're going to intubate you and breathe for you and you're going to be completely under. Now, I won't be undergoing full-blown general anesthesia today. What I assume they'll be doing is something called MAC, or moderate anesthesia care. That's what we refer to as conscious sedation, what you may know as being kind of in that twilight loopy feeling, like when you go to the dentist and they kind of make you a little bit loopy. The idea is basically take the edge off, reduce some of the anxiety, and kind of dull the pain while you get the injection. So what they're really going to be doing is local anesthesia. I'm assuming either using lidocaine or Marcaine, which lasts a little bit longer, to numb the area locally. They may add a little bit of epinephrine in there to stop bleeding. I'm not sure. They're probably going to do it, if I had to guess, around the neckline. We usually like to do it as proximal as possible. That means it's kind of as close to the root as possible. So for example, if you were going to say, numb a finger or do a procedure on a finger like a tip, you wouldn't, just numb right here. You would actually numb right here, more proximal. So I'm guessing they'll probably numb me all around the bottom here, kind of towards my neck, and then maybe again around here too. And that MAC, or moderate anesthesia care, will come in handy during that time because they're probably going to need to stick me, I bet, probably 20 plus times all around to just make sure the entire scalp is numb. Now, moderate anesthesia care is usually done with Versed or propofol or fentanyl. Some of those you may know. I don't think they're using propofol, and I only know that because I've watched some of the videos, and whenever I see them giving the initial anesthesia, it's clear, and propofol I know is being milky. No, I'm no anesthesiologist, but usually when I'm looking up at the table, I'm kind of seeing what the anesthesiologist is doing, and when they say they're pushing propofol, it's always white, so I definitely know that it's an emulsion. It's white. It's not what I'm getting, so you don't have to worry about me. I'm not going to Michael Jackson die on you guys today. I'll probably get a little bit of Versed, just be kind of calm for like 15-20 minutes while they numb me up, and then I should be good. And then the fun begins. So again, they're going to be removing my hair from what's known as DHT resistant spots, which is mainly kind of down here and a little bit on the sides. They may have to go up, which is one of the concerns with this procedure, is if they do have to go up, they are technically taking DHT sensitive follicles and transferring them. So it is a possibility that I may lose these again in the future, and this is something I'm fully aware of. I'm also aware of they're just going to be doing the anterior part of my scalp right here, or the hairline, and it's possible that I will recede posteriorly or in the back, in the vertex, more of the crown area, which I know that inevitably I will. My hope is that maybe at one point I'll have more hair to donate to that area, or I'll just shave my head. You guys have seen me with a shaved head. I don't really mind it. This is maybe buying me 5, 10, 15 years. Great. If I need to go full-blown shaved, I'm cool with it. But that's going to be today's agenda. I will talk to you guys later. I'm probably going to be a bloody bandaged mess. I'll see you then. Okay, we're back. So that was a pretty interesting, very long day. So the day started around 7 when they picked me up. We drove to the clinic, which was only about an 8 or 10 minute drive. Super easy. The clinic was very nice. I met with the clinic owner. Him and I hung out for quite a while. He talked to me about all the different options that I could do. He took a look at my hair. He evaluated it. He gave me his opinion on what he thought the best procedure or procedures would be, which ended up being a little bit different than what we had talked about online, which I think is inevitable. If you're just having a Zoom meeting, you can't really do a good physical exam. And then when you meet in office, you can, and maybe, you do a little bit of a game day plan change, and that's totally okay. Basically, what we determined is that my crown had a lot more thinning than I even thought. It wasn't until I saw pictures that I was like, oh crap, I'm like actually legitimately balding. I haven't really noticed for the past few years, but they always say you don't notice until it's like 50% gone. And I kind of started noticing like 3 years ago. So now it's, so much more. And I can't really tell when I look in the mirror because I think my hairline's been pretty deceivingly okay. But when I buzzed it and then I got pictures, when I was looking at the pictures, if I have any, I'm going to put them up here because looking in the clinic pictures are like, oh wow, yeah, this is problematic. And earlier I mentioned how with the FUE, you run the risk of having to go higher up to grab some hair follicles, and that higher up can also be sensitive to DHT, and that's what I was getting. So mine I thought was just a little bit more anterior on the vertex, but it was actually coming down into like the occipital area of my scalp, which is kind of crappy. I didn't really realize that it had hair loss going that far back. I thought you could only see it if you were at the top. So after seeing that, we just decided that we were going to do some work up there too. He also said that my hair is very thin, which it is. I've got that Anglo-Saxon, very blonde hair that's very thin. The strand is actually very thin. I've got a lot of them, but they're all very thin, and a lot of them just contain like one hair. So the follicle can contain 1 to, I don't know, probably 4 or 5. Don't quote me on that. I'm not a dermatologist or a hair specialist, but they can contain a lot of follicles, and those are the ones that they really like to grab because, you're getting more bang for your buck. If you grab one and get like 3 or 4 hairs, that's a lot better than obviously taking out one. But I have very thin hairs and a lot of just 1s and 2s and the occasional 3 scattered in there. Not the best hair starting out for a hair transplant. And that's something to be very cognizant of going into that. Your results are not going to be the exact same as the influencer, like me, that you see doing a video on this. So you can't expect to have like the hair of your dreams going to get a hair transplant because you may be genetically different than them and you may just not be a great fit for a hair transplant. Sorry, been a long day. So what he basically said is let's focus and put most of it here where it's actually, completely bald, which I really came in caring about. Let's try to put some in here and cover up as much as we can right now. But he said we may need to do a procedure in the future, like in a year or so, if there's still enough remaining donor follicles, and put more up here where he thinks that it will continue to thin. And I would agree with that. I don't think it's like a sales tactic or anything like come back for more. He was very honest that we may take too much and you may not look good if we were to do another one. That's something that we would reevaluate in a year's time. So after that, they shaved me, which I was okay with because I just shaved my head like 2 weeks ago, so I was used to it. And then he said that I looked like Johnny Sins, which is funny. He shouldn't know who that is. Pornography is banned here in Turkey. You guys must be breaking the law. But anyways, a lot of people have told me that when I completely buzz my head, I kind of look like Johnny Sins, and hey, that's okay. I just wish that when I buzz my head, I got some of those other attributes, if you know what I mean. And then we headed into the OR, or maybe they call it the surgical theater here. I always like how the Brits call it the surgical theater, and even some Americans do when they're like cool and old school or a true OG. They're like, we're going to the operating theater. But I like that. Anyways, we went into the OR. At that point, the anesthesiologist came in. We talked, and that's when he gave me the monitored anesthesia care, which I was telling you about earlier. Again, it was clear. I definitely remember asking him, is this Versed or fentanyl or what is this? And he just pushed. He didn't tell me. And that may have been like a little bit of a language barrier, or also just maybe an anesthesiologist being like, whatever I say to you right now, you're not even going to remember. But he pushed that. And I remember sitting there for a second, like waiting for his response, doing a little chuckle because I felt it coming on, like, yep, I'm about to be high, and it kind of felt funny. And then it kind of turned into really a dissociative event, what felt like maybe, I don't know, a few minutes worth of me just closing my eyes and kind of seeing shapes. I was literally felt like I was like soaring through pink hills, and all I remember thinking is, I would really like to be listening to some music right now. And I was like thinking, I might have even told them like, hey, can you guys go get my headphones? I want to listen to some music. I was thinking I wanted to listen to something trippy, like old Mars Volta. That's what I was thinking about, the deloused in the comatorium, because I felt like I was kind of in a coma and experiencing that. And I was thinking it would be sick to rock out to some old Mars Volta. Anyways, that wore off like really quickly, and then I was just kind of groggy, kind of droopy, and then I just sat there while they went to town. And I think what they did first, or obviously what they did first, was the harvesting. I was laying on my face that way, like a massage. I think I fell asleep quite a few times. Like, it was pretty chill. I definitely did not feel a thing. I never needed to tell them like, stop, I need more or anything. Super easy. Could not feel a darn thing. Just felt like I was wearing a helmet all day. It still kind of does. After the harvesting was done, they let me go out and they made me a breakfast, which was cool because, again, I hadn't eaten, but they weren't going to do that monitored anesthesia care anymore, so we don't need to worry about asphyxiation anymore. So they gave me some, trying to remember, it was eggs and I can't remember what else, like olives. It was definitely like a Turkish type breakfast. It was pretty darn good. And then we headed back into the OR where the actual transplantation began. And they started with this part of our tech scalp. They used DHI, which I think is direct hair implantation. I hope I'm right. Whatever. That's what we're going to call it. So it's just kind of a different technique. It's essentially, in my opinion, kind of a marketing gimmick, not necessarily gimmick, but just a same thing, different device of a FUE. You're still extracting the follicle and putting it, you're just using a different device. I can't remember all the nuances, minutiae, the differences. Maybe I'll list them right here. But basically they did the DHI right here. That probably took, I don't know, an hour or two. That one didn't feel that bad. And then we got to the FUE, which was the front part. And this part didn't feel bad. It was just very, very long. I think it was like 3 hours. And initially they warned me this is going to be 6 to 8 hour day. And then they got me all cleaned up, bandaged. One thing that I would say here is I wore this t-shirt, and at the end, there's definitely a language barrier with a lot of them, like the nurses and things. They just said, no good, no good. I'm like, oh, fuck yeah, I get what you're saying. Like, we had to stretch the hell out of the neckband. So I would recommend that if you come here or you go anywhere for a hair transplant, even in the States or any other country, bring a button-up shirt. That would probably be the best thing to do, so you can just slide in and out. After that, they gave me my care package. It contains this neck pillow, which I have to wear tonight to sleep on. They also said I could use other pillows to prop up my neck. I'll report on how the night goes. I don't know. I'm not looking forward to it. I've already had a really hard time sleeping due to jet lag, but I'm going to try to keep pressure off my head is the moral of that story. Next, they gave me medication. This is an interesting thing. So they gave me the equivalent of acetaminophen or Tylenol. They gave me clopidogrel, which is Plavix, which is like an anti-clotting medication, which is one thing that I do think is kind of interesting. I wonder what the risk of clotting with a hair transplant procedure is. I'm not sure. I would imagine it's pretty low. So I don't know the justification behind that or if I absolutely need it. I think I will take it. One, because I'm on TRT and already have an elevated hematocrit hemoglobin, though the clopidogrel won't do much for that. But still, I have elevated levels, and I have a 13-hour flight. So I'm like, hey, if I have some antiplatelet in there, that's okay with me. I think that's fine. So I will take the 3 days worth that they gave me of that. They also gave me Cipro, and that's an antibiotic, so a post-op antibiotic. And this one, personally, I really don't think is necessary, and I probably won't take it. And here's why. I simply don't think that it's warranted. We don't routinely give post-op antibiotics anymore. It's something that kind of used to do. And then we got these nasty things like MRSA, which popped up due to the overprescribing of antibiotics for routine things like this that may not need it. When I do actual surgery and I cut a patient open and I put in hardware, I rarely give antibiotics unless there's something that happened intra-op that concerns me. Like maybe I was scared that the surgical, the sterile field was contaminated, or maybe they had an adjacent wound, which wouldn't ever happen because I'm never going to put an implant in with somebody who has a wound. But just, the moral of that story is that I really don't routinely give post-op antibiotics, and those are with much bigger surgeries. Now, if it's something containing a dirty area, like if I'm working on a wound, or if we're doing something in the bowel or near the rectum, if it's considered a dirty procedure, I definitely would, but I just don't see this as warranting antibiotic use. I'd be really interested to know what any hair transplant surgeons out there are doing and if they routinely recommend taking post-op antibiotics. I was trained to never really give them unless we absolutely think that we need to. What's more, I got 2 grams of Ancef, which is an antibiotic, in the surgery. I saw him push it, and that's what I would do in my surgeries usually too. There's even debate on that now, whether or not that's needed, like doing intra-op antibiotics. So again, we're trying to get away from overusing antibiotics, and sometimes I think surgically we do, and I think this may be an overuse. And also, I kept a really close eye on them while I was awake as much as I could to make sure that they were maintaining the sterile field. And this is something that I definitely want to report on because I think this is where my kind of perspective is unique to a lot of the other YouTubers out there. So I think when we think we're going to Turkey, we think that we're getting kind of a lesser than service and something that's not up to par with the United States or other countries where you might get surgery. But my experience was honestly very, very similar to anything that I would have done myself in the US. It wasn't a completely sterile procedure, and I don't think that it's meant to be. Again, I would love to hear other hair transplant surgeons comment below. They may say that this is done in a full sterile operating room. This one was not. It was more of like an office surgery, similar to when I would do like an excision of say a skin cancer or a benign lesion, or if I would do a nail removal. Again, sorry, long day. We don't do a full sterile field when we do that. What we do is we call it clean. We try to make everything as sterile as possible, but we don't get into the nitty gritty of like scrubbing in beforehand and wearing all sterile gowns and having a sterile field. We don't do all of that, but they actually did a lot of that. It was kind of like a sterile clean hybrid. But I really kept a close eye on their sterile technique, like how they gloved. They did that really well. There was even a time that a girl gloved and then she went and moved the light stand, and I was like, oh, hell no. If she doesn't change that glove, I'm going to have to call it out. Because I was sitting there kind of getting nervous, but I really didn't want to have to call it out too because I hate being that person. And then I was just having this like internal battle and anxiety, like, oh my God, is she going to touch me with that glove that just touched the light stand? And she took it off and changed it, which is exactly what she should have done. So that was really cool. And I never saw them, dirty their gloves. They put protective things over anything that they would be touching. They kept their hands up. They were very, very clean, and they seemed to have really good sterile technique. So my perspective as a doctor and a surgeon, someone who does a lot of surgery in the OR and understands sterile technique and good operating procedures, I would say that they were up to par with anything that you would get in the US. So I wouldn't worry about that. Now, at the intro of this video, I commented on how the Reddit trolls say that the nurses or the techs or whoever they are do the surgery, and they did. And again, I'm not worried about that. And I was actually sitting there thinking about it. And remember I mentioned that I'd heard other doctors like Gary Linkoff say that he knows how to do the surgery, that he has done the surgery, that he can do the surgery, but oftentimes his nurses do the surgery. And I was thinking, yeah, how long this procedure took, remember 6 to 8 hours, like in order for it to even make sense for a surgeon to do, you would need to kind of utilize and leverage your nurses so that you could be making money somewhere else. And I understand why it is so expensive in the US now, because it's going to take a team of probably like 4 people. You have somebody doing the anesthesia. You have the surgeon who's going to draw the line, do the initial incisions. You have the tech team or the nurse team. That's probably 3 or 4, and they probably swap out a few times. So you maybe even need a team of like 6 or 8. And that's going to take 8 hours. So you got to pay, the bills to keep the place running. You got to pay for all the procedures, the sterilization, the medication, all that goes into it. I definitely understand why it is such an expensive procedure now. It's not something like, a breast augmentation. A doc can probably bust out, like some of these docs, I'm sure, do it in like a half hour because it's just, back of hand to them. Of course, you have more complicated cases sometimes. I'm sure they go on longer. But all that to say, like a breast augmentation is probably done super quickly as compared to a hair transplant, which is insanely tedious. And I was just sitting there thinking, kudos to them. Because again, I was just laying there and getting like super anxious and bored and pestered. And I was just imagining what they felt like with their arms up. Because remember, they're staying sterile. They got to keep their arms up. And then they have the donors on their hand and they're transferring them for 3 hours. I'm like, dang, their delts and traps are probably burning. Like, that's just awful. So I highly understand the cost. I don't know why I went off on that tangent, but it was all to say, I think it was to say that I think they had good sterile technique, that the procedure was on par with the US, and that I'm not going to take the antibiotics. I will take the acetaminophen. I'm going to take it prophylactically before I get pain. I can start to feel it wearing off now. That's what I would tell my patients to do, is just take it before it hurts. I always tell people take the pain med before it hurts. So that's what I would recommend. But yeah, that was my day in a nutshell. So I'm going to try to get some sleep here soon. I'll talk to you guys tomorrow where I go back and I get the bandages taken off. Hold up, you're not done with me yet. I said I'd talk to you tomorrow, but this is fresh on my mind. I forgot to bring it up, which is the hairline. So when I initially met and we talked about what I wanted, I was really adamant that I didn't want a very immature hairline. And what I mean by that is very low and straight across. And I've seen a lot of guys coming out of Turkey with just a straight across hairline, and they honestly look like they're a 10-year-old African-American boy, but they're a 45-year-old grown white man, and it looks very weird. And I did not want that. I don't want that look. I'm 35. I'm going to continue to age. Naturally, my hair would have a little bit of recession. I mean, you even look at the best hairlines in Hollywood, like take Brad Pitt, for example. Even he has a little bit of recession, which looks normal. It would look really weird if he had a hairline in the middle of his forehead that just went straight across, right? What he was saying is that people come in saying that they want that hairline, which I could see because it seems to be a popular hairline in the US. I don't know why men want to look like little boys. But anyways, looking at myself here, I tried to get it to go back a little bit more. I wanted it to even look like it had some of my natural, I've always had kind of a more mature hairline where it comes down to kind of a peak. I wanted to keep that. So follow back my natural recession, just filled in a little bit. And then he added in this area. I don't know what kind of the hair world calls it, but in this temporal area, kind of right here, he added that in on either side because mine had actually receded quite a bit too, which another thing I didn't even notice. Again, you don't really notice this until it's gone too far. But I think it looks really good. I was actually happy with that. He thought that it would look better when he drew it out. I was like, yeah, I think you're right. So I think I'm going to be pretty happy with the hairline. I just didn't want it too low, and I was really happy that he listened to me. I was afraid that when people come here, they all get cookie cutter, straight line across the forehead, but that wasn't the case. They really worked with me, and we did change it a few times. One time was a little bit too straight, and then we didn't start out with these, so then we added these in, and we kind of toyed with it. So that was really cool. I'm really happy that they did that. I think that is super important. I would not go to somebody who pumps out the exact same person no matter what you ask for. You obviously don't want that in any physician or clinic or who's ever doing your hair. So that's another point. So now I am really going to try to get some food and get some sleep. And I promise this time I'll see you tomorrow, unless I have some freak accident in the night, and then I'll show you because I'm sure you're going to want to see it. All right, good morning, guys. The night went actually really well. I slept with a neck pillow. It actually wasn't that bad at all. I actually slept really good last night. There was no pain. Literally did not get any pain at all last night. I did take 500 milligrams of acetaminophen, as I said, kind of prophylactically when I felt like the numbing was starting to wear off. But that's all I took, and I feel absolutely zero pain. Like still, if I poke, then it's a little bit tender. I'm talking like literally 1 or 2 out of 10 pain. And I'm kind of a baby when it comes to pain. So this is not a painful procedure, at least not where I had it done, which is awesome. The bandage is kind of lifting off, as you can see. Looking in the viewfinder now, and yeah, I'm kind of flaring out, and I had to walk down and get breakfast that way in the hotel. And I wish that I just had a little piece of tape so I could close it, because this one's a little bloody, and I just feel like it's a little kind of graphic to be walking around with a bloody bandage on your head. I would just like to put a little piece of paper tape over that. But oh well, they're gonna come pick me up here soon and take me over to the clinic to remove the bandage. I could just do it here, and I really want to, but I'll just let them do their normal thing. That would be on the agenda today. But anyways, guys, I'm going to go try to shower my body without getting my head wet, and they'll pick me up, we'll get the bandages off, and then, I don't know, maybe go visit Istanbul. Hey guys, what is up? We are at the end of day 2. Now, I was going to do this tomorrow, day 3, but I just don't think that I'm going to have any natural sunlight in the hotel room in order to film. I want to make sure this is relatively decent quality for you guys, but I'll go over what tomorrow's plans are too. So today I went to the clinic, they took off the bandages. That was the most painful part of the entire ordeal. And for that, the pain was maybe, I want to say 4 out of 10. It was only painful on the areas that were stuck with the scab. So I think this happens a lot. And one thing that I do with my patients after surgery is I almost always get sterile saline and I pour it on while I am pulling off the gauze. I also really like to use like a non-stick gauze, and I like to put down a kind of petroleum-like or an ointment before, if I know that I'm going to need to take off the gauze. That is something that I kind of wish that maybe they would do, is use like a non-stick pad or use saline to get it off, or use an ointment to cover it when they do, so that you don't deal with that. Because that was pretty painful, which led to some bleeding from some of those areas where the scab broke. That was kind of annoying, because then the nurse had to hold it down, and that kind of hurt too. But again, that was like maybe a 4, probably more like a 3 out of 10 pain. And I'm kind of a baby when it comes to this acute pain, so it wasn't really all that bad. I'm just trying to find, some bit of pain for this procedure, because all in all, this has been essentially pain-free. After that, the crew of Hair Center of Turkey took me out to Istanbul to experience some of the local culture, which was really cool. I asked them if they could do that for me. They said they do that for their patients whenever they ask. They'll kind of take you around, give you a tour, take you out to some local eats. That was a lot of fun, because I haven't really been to like a Middle East country before, and I kind of got to experience that, which is awesome. Turkey kind of reminds me of like a hybrid between Europe and the Middle East. It was really cool to walk through some of the little markets and see the food out and try some of the local foods. I got some really good baklava and kebabs. I really enjoyed that stuff. It was a ton of fun. But there's a caveat there. I do think that maybe I overdid it a little bit today. Towards the end of the day, I was starting to get kind of malaised, fatigued. It didn't really feel good, and I don't think that I really should have done that much activity on post-op day 1. In fact, I would always tell my patients to not do that, and sometimes us doctors are really bad patients. So I would recommend not doing that. I mean, I'm only in Istanbul once. That was the only time that we could schedule it, so I understand that was the only time that they could take me there. Though if I could go back, I would probably prefer to do it before the surgery. I think that would be ideal. And that's something I'll get to a little bit later on when I talk about the things that I wish I knew, or the things that I wish I would have done differently. But before that, let's talk about what I'm going to do tomorrow, which is go back to the clinic for the 3rd day in a row. And tomorrow they're going to give me the first gentle wash. Now, I assume it'll be very gentle. Probably essentially just pouring a little bit of water over my head, maybe using a light foam to gently clean the area just to help to remove any bacterial burden. But you really don't want to put a lot of pressure on these grafts. That's one thing that I just kind of realized, that wound care for the scalp for hair grafts is much different. See, for the past few days, I was wondering like, hey, why are they not covering this? Why aren't I putting ointment on it? Because in wound care, you always want to keep a wound moist. A lot of people always think open the wound to fresh air. That's actually the last thing that we do as wound care specialists. We do not want the wound to ever dry out or be exposed to fresh air. But then it dawned on me like, hey, this isn't a normal wound. You have hair transplants there, which are very fragile and we don't want to rub them out. So I assume that's probably why they first don't put a bandage on, because again, just like when they pulled off the back, it ripped off scabs. Imagine if it ripped out some hair grafts, you're going to be pretty pissed off. Additionally, you probably don't want to rub any cream on there just because again, they're so fragile. So you don't want to be touching it, applying any pressure. So they basically just leave it for at least a few days so that that can kind of take hold in there and you don't end up wasting your money and your precious time just wiping away the grafts. So anyways, they're going to wash me up and then they're going to probably apply ointment again to the donor area and then send me on my way, and I'll hop on that flight back to Dallas. And now I also want to recommend what I'll be doing for post-op care, from medical management to topical management. So what I will do is basically follow their topical management to a T with whatever they tell me to do. In fact, they've given me a special foam cleanser and a shampoo already. I believe they're going to give me some type of ointment to put on later on. So I'll follow whatever they tell me to do when it comes to that. But on top of that, you know, I'm going to get a little creative. If you know me, you know that I'm in the space of health optimization, peptides, things like that. So I figure why not leverage them since I have access to them. So I plan to run BPC 157 and TB 500. Both of those can help wound healing. I don't know if they have any impact on hair, but pretty much what they'll do is increase growth factors like VEGF, they'll increase angiogenesis, and that can't be a bad thing for healing any wound. Question I often get with those is, do you need to do it local to the injury? And I do not believe so. I don't think that there's any science backing that at all. For example, say you have elbow tendonitis and you're injecting in the subcutaneous space above the injury, that's still just getting picked up by lymph and capillaries and then going systemic anyways. It's not like it's going to go down and get the wound. So the same thing happens for my hair. I'm not going to obviously do it topically or near the area. I mean, that would be painful and awful. I'm just probably going to do it in my abdomen like any other subcutaneous injection and hope that it does go systemic and lead to some of those improved growth factors and better wound healing. Another one I'm really excited to add in is GHK-Cu, which stands for GHK copper. It's copper peptide, and there's a lot of really good data to support its use in wound healing and, more importantly, in hair growth. This is a peptide I'm really excited about in general, and I think that it will have a lot of utility in the future in wound healing. And I'm excited to see some of the formulas that are kind of developed around it. But I'm really excited to do my own self-experimentation with this one. Now, when it comes to classic medical management, what most surgeons would tell you, and most people would say what most good surgeons will tell you, is you absolutely have to take a DHT blocker, is what we call them. They're actually 5-alpha reductase inhibitors. They block the enzyme that converts testosterone into DHT. DHT, of course, being the causative agent in hair loss. I would argue one of the causative agents in hair loss. I'm a firm believer that hair loss isn't caused only by DHT and DHT alone. I also do think that all androgens, not only DHT, play a role in hair loss. So am I going to use a 5-alpha reductase inhibitor? This one's going to get me the most hate, but I am not. I'm not going to do it. I personally just do not believe in them. And now I've opened up the floodgate of trolls. There's probably going to be a subreddit on me talking about how much of an idiot I am, because I've made a video on hair loss before. And I personally said that I wasn't a huge fan of these medications, and everybody, lost their shit over it. It always happens. I even was just on Simon Hill's podcast recently. Again, I gave a really nuanced explanation as to why I, in particular, am not a fan. I think that I was very accurate in my representation of the literature, saying around only 2% of people get side effects, but I just do not want to take that chance. And inevitably, somebody went in there and just writing paragraph after paragraph. Like, the people who love finasteride really love finasteride, and they go to war when you bring up anything negative about it. But personally, I have just worked with thousands of guys over the past few years, not all of which have had post-finasteride syndrome, but I see a ton of post-finasteride syndrome. And just because the literature says that only 2% of people experience side effects, I just do not think that that is true. One thing that I think occurs is that people may be getting side effects and not attribute it to the finasteride. And why I think that occurs is that when it has to do with the androgen receptor, these things take time. Think about this. When you started puberty, you were probably 12 or 13. When did you actually start growing a beard? When's the last time you saw a 13-year-old with a beard? Occasionally you see that like one 13-year-old on the playground who everyone kind of idolizes because he looks like a man. He has like a little bit of a mustache. But other than that, most of us probably don't get a beard until honestly, like after high school. We have the same amount of testosterone, but it takes a long time for androgens to exert their genomic effect and cause the masculinizing effects. And that's just the truth of it. So why is it so hard to believe that some guys may take finasteride and not have an androgen-related effect until years later? What I hear time and time again is, hey, I started taking finasteride 2 years ago, but now, suddenly, 2 years later, I have a loss of libido, I'm feeling super depressed, my semen's very watery, I can't get an erection, but I don't think it's the finasteride, it must be my testosterone. We test their testosterone is actually usually pretty good because finasteride will actually increase testosterone kind of by way of not making it 5-alpha reduce into DHT, so it's usually not their testosterone, everything else seems to be dialed in. Is that post-finasteride syndrome, or it's actually kind of like current finasteride syndrome? Well, most people would say no because they didn't get it on the onset of taking it. I would just argue, I think there's a little bit more to it. Anyways, this should not turn into a video about how I do not like finasteride or dutasteride because, again, I try to give a nuanced kind of explanation of why I don't want to take them. I personally just don't want to risk it. I would honestly so much rather be bald than to not have a happy, healthy sex life and not have the motivation and drive that I do know that DHT gives me. A lot of people argue that DHT is completely useless. That's fine. You can have that belief. Please let me have my belief that I think DHT is very crucial in males. So I am just not going to take it. So what will I do if all my hair falls out? Well, that is a really valid possibility. It may occur. So this is what I would hope to do. And what would likely happen is the hair here and what they just put here would be okay because they just moved DHT resistant follicles to those areas. So the DHT would probably impact the hair behind it. Sometimes guys get this weird kind of hairline where they have hair up front and around and then everything behind balds. And that's a possibility again. Well, what would I do if this occurs to me? Well, I would really, really hope and pray that I have enough hair for another transplant. That would be awesome. If so, I would get that. And hopefully with the entire ordeal by 5, 10, 15 years. And at that point, I'm going to be pretty darn old. I'll damn near almost be a senior citizen and I'll just shave my head because I've honestly shaved my head multiple times now and I like it. I think I look pretty good with a shaved head. So I really wouldn't care if I had to shave my head. Another awesome possibility would be if we could clone DHT resistant follicles by that point and then have hair clones. And then I'd probably get the most awesome hair ever. Honestly, I'd just get that transplanted in all over and we would all have really good hair by then. And I think that may be something that we see in the future. That may be reality. That would be really, really cool. So hopefully I can write it out until then. If not, oh well. Again, this was relatively inexpensive being in Turkey. I will be okay if I have to shave my hair. That's just me. Please do not hate or do. It's engagement, whatever. Leave the comment. Let me know I'm an idiot. But that's not the only hair loss medication we have. I will also definitely be using minoxidil. And minoxidil is not a hair loss preventer. It is a hair growth stimulator. So we'll definitely be using that kind of all over the scalp. In particular, I think that you want to use it in the areas that receive the hair to promote that increased blood flow and growth there. Something I'm kind of interested in is exploring oral minoxidil. I've never taken it myself. Usually I used to kind of recommend against guys taking it because what I've seen is it causes hair growth all over the entire body. Some guys don't want that. I actually wouldn't care. I'm relatively low hair and a lot of my hairs are blonde. So like I do have chest hair and butt hair, but it's so blonde that you can't even see it unless you're up close. And Victoria gets to see it and she oddly likes like my chest hair and stuff, which is cool. So I guess I wouldn't care really if I grew a lot of hair all over my body. But what made me reconsider was that, again, I was watching a Dr. Gary Linkoff. Shoot. Forgot his Linkoff, I believe. Yeah. Dr. Gary Linkoff video. And he was saying that he actually prefers to give oral minoxidil to his patients. And then that got me thinking, like, is it more superior? Then I went and read a meta-analysis and it seems like it is not superior. It seems to be kind of equal. I think the favor was slightly, not statistically significantly, in the favor of topical minoxidil, though the thing with it is the compliance. With minoxidil, you do need to apply it 2 times a day. Now, I've been using minoxidil for the past 3 years, I think, and I will tell you the amount of times I've done it twice a day is probably like 5. Most people just cannot adhere to twice daily application. I usually apply mine first thing in the morning right after a shower, and then I usually forget to do it again before going to bed, even if I do shower. It's just not something that I routinely think of doing. So I think where the oral minoxidil wins is that the compliance factor is much, much easier. You just pop a pill. Now I wonder what it would be like to take both topical and oral. I don't know. I'd have to look into that. I wonder if any data has, if any data has been published on it. I don't know. I'll let you guys know if I find any. You guys see the swelling I'm getting here? It's kind of taking away my forehead wrinkles, which is nice, but I'm hoping by tomorrow on the flight, I don't have a big old puffy hair or head. My friend just got it recently and he had just like these massive lobs of inflammation there. I'm hoping to prevent that. But last but not least is the things that I wish I would have known and the things that I wish I would have done differently coming into all of this. First and foremost, maybe having done it sooner. Again, I kind of underestimated the amount of hair loss that I had. And this is something that people in the hair space say over and over and over again. You got to catch it early. I just have never wanted to be too consumed with my hair. I didn't want to be that hair loss fanatic that was freaking out about it. I thought, hey, I'll just use topical minoxidil. Let it be. If it falls out, it falls out. And then eventually I got to thinking like, hey, maybe I don't actually want it to all fall out. I would like to have a decent hairline, but by then it was too late. So it's kind of hard. If you do not mind kind of being the person that obsesses over it, then do it and do it early. If you don't care, that's probably superior because man, this stuff messes with your head. Anything that's body image related will always mess with your head. But I do wish I would have gone and done the procedure earlier because like I said, they were having a hard time finding actual good viable donors because my hair loss had progressed pretty posteriorly or behind, it was going down, like I said, towards the occipital area, which is pretty darn low, and that's slightly concerning. So I do wish that I would have done this earlier. Second, if you can afford to take business class, which is like the first class of the international flight, I would highly recommend doing that because it's a very long flight. I think mine was like 12 hours or something. And especially on the way back, I would not want to be in economy. I'm going to personally try to upgrade because I did economy on the way here because you all know me. I'm super cheap. I hate paying for a lot of money for anything. So I was like, I'll just rough it out in economy. It was not that bad whatsoever. I did okay. But now I'm thinking like, I do not want to be around all the crying babies that I heard and all the people next to me and bumping into me. And when I was leaning over to the side, falling asleep, people would hit my head. And I'm just thinking, God, this is a recipe for just a nightmare of a time on the plane. So I do think I'll try to upgrade. I would highly recommend save up if you're going to come to Turkey and do the business class, at least on the way back. Next would be to definitely bring all button-up shirts. Don't be like me and just bring pullovers. That was an awful idea. I don't know why. I just completely forgot that I ever read that, but I highly recommend please bring button-ups. Even if you do this stateside or in your country, have button-ups ready. It'll make life so much easier. Next, I would invest in a really good neck pillow, and it's something that I may do actually tonight and have it ready for me at home via Amazon. The one that they give you at the clinic just isn't that great for comfort. It works really well. Don't get me wrong. My head was not bobbing, but I do want something that's a little bit more soft. And then I would say make a trip out of this and bring a loved one or a friend. I came alone, which sucks because I did it last minute. Literally like kind of reached out to Hair Center of Turkey and then they were like, hey, we've got availability next week. And I was like, Victoria, should I do this? She's like, yeah, if it makes you happy, go do it. I'm like, damn, great. I guess I'll do it. I'm going to Turkey. So it happened like literally within a week. It was just so fast. But because of that, Victoria's schedule was already fully booked. She couldn't make it. So I had to come alone. And again, today was not the day that I should have gone exploring Istanbul. I'd even say any day post-op probably isn't the best time to explore the busy streets of Istanbul and see all the cool sights, eat all the food. You just don't really want to be doing that on a post-op day. So come a few days early with a friend or a loved one, enjoy all of the cool areas. I would highly recommend that. Okay, guys, I think this is going to be the longest video that I have ever done, but I hope that it's a full, inclusive video of everything that you can hope to expect if you come to Turkey for a hair transplant. The last thing that I have to do is make it home on the plane. I have to look like this. I don't have a hat. I actually did bring a hat, and before coming here, I was thinking, even if they tell me not to, I'm gonna wear a super loose hat. I don't want people looking at me. And then I just thought, you know what? I don't give up. Because, why? Why would I? This is something I preach to people all the time. People do not care about you. They really don't. Of course, people are going to look at me, and then for like 2 seconds, they're going to think that guy looks really weird. They're probably not going to see any other part of me. They're not going to know my name. They're not going to know anything about me. Guess what? Even if they did, who the hell cares what they think? Who cares what anybody thinks about you? Which then kind of goes full circle into like, why did I do this in the first place? Why would anybody put themselves through this? But let's just save the philosophical debate for another day. Pick your battles when you decide who cares about you when you're going home from Istanbul to America. There's going to be other people all bandaged up. You're a crew, some wounded warriors coming home. yeah, I'm not going to care. But anyways, I hope you guys really enjoyed this. I hope you guys learned a lot about it. It's something that I wish that I would have had. And I did explore a lot of people, like Brett Maverick did a few really good ones. Dr. Gary Linkoff, shout out to you for all the information that I kind of tried to very quickly digest. And hey, maybe he'll react to this one and get me some followers. No, but really, I'd really like some of his opinions on like the wound care and the post-op antibiotics and things like that, which, oh, by the way, I decided not to take the fluoroquinolone. I just don't think it's the best choice for this hair. I know he did it because he thinks that I have an allergy to cephalosporin, though I just would have rather had better coverage than taking Levo. I don't think it's an ideal antibiotic, and I think that'll be fine. I also looked up some papers. I found one in 2005 that said that they did not think that it was necessary whatsoever to use antibiotics in post-op care. So there's that. Anyways, hope you guys enjoyed the video. I will see you in the next one. Wait, I am back. I just wanted to say one last thing. Huge shout out to Hair Centers of Turkey. You guys were awesome. Thank you so much. I highly recommend them. They were extremely professional in everything. I loved everything that they did for me. And by the way, sorry for not wearing a shirt in this whole second part of this, or this whole last day part. I just, again, made a really bad mistake and didn't bring button-ups. Didn't know how to deal with pulling a pullover and possibly screwing up my hair and then taking it right off before I go to bed again, which I'm about to do. But okay, I am sorry. I just wanted to get that last bit in real quick. I am really leaving now. And this time I will see you guys in the next one.